Why we need a holistic approach toward treating fatigue, Part 1. What is wrong with the conventional medical model and chronic fatigue? In order to see why in many cases a holistic approach is necessary to understanding and resolving chronic fatigue, we first have to look at why conventional medicine fails to properly address this problem. According to the Center for Disease Control's website, more than 1 million Americans have what is called chronic fatigue syndrome, or CFS. But what exactly is chronic fatigue syndrome? Simply being tired all the time by itself does not qualify anyone for the diagnosis of chronic fatigue syndrome. Specific criteria must be met, the first of which is severe chronic fatigue of 6 months or longer duration, with other known medical conditions excluded by clinical diagnosis. In other words, chronic fatigue syndrome is not diagnosed by blood test, microscopic exam imaging, or any sort of objective lab test. All chronic fatigue syndrome really is a label conventional medicine has for fatigued people when doctors don't understand where the fatigue is coming from. The National Institute of Health even says, in clinical practice, no test can be recommended for the specific purpose of diagnosing chronic fatigue syndrome. Tests should be diagnosed towards confirming or excluding other possible clinical conditions. But there's a second criteria which must also be met to diagnose someone with chronic fatigue syndrome. The patient must also have 4 of the following symptoms: substantial impairment in short-term memory or concentration, sore throat, tender lymph nodes, muscle pain, multiple joint pain without swelling or redness, headaches of a new type, pattern, or severity, unrefreshing sleep, or post-exertional malaise lasting more than 24 hours. This additional criteria doesn't represent an actual pathology or underlying cause of fatigue, but this is rather just additional symptoms that doctors have noticed many people with unexplained fatigue often also have. Remember, when it comes down to it, chronic fatigue syndrome isn't a diagnosis of exclusion based upon not actual lab tests, and it simply means someone is chronically fatigued and doctors cannot explain why. The National Institute of Health's website states, no one knows what causes chronic fatigue syndrome. It is most common in women in their 40s and 50s, but anyone can have it. It can last for years. There is no cure for CFS, so the goal of treatment is to improve symptoms. Medicines may treat pain, sleep disorders, and other problems. Therefore, even with a diagnosis, treatments are only to reduce symptoms of the problem. They are not to actually correct the underlying medical issue causing the fatigue. To be fair, according to the CDC, there are many other possible causes of fatigue, such as hypothyroidism, hormonal disorders, sleep apnea and narcolepsy, autoimmune disease, chronic mononucleosis, subacute infections, cancer, obesity, and reactions to prescribed medications. Based upon this official information, you would think that when patients complain to the doctors about fatigue, this would lead to a thorough workup to discover the cause of the fatigue. But the feedback that I get from people who tell me they complain to the doctors about fatigue indicate that every possible cause of fatigue is usually not considered, nor are these patients diagnosed with chronic fatigue syndrome. One very typical response patients get from the doctors is to have a CBC and basic blood labs run, a thyroid panel, plus perhaps maybe some other tests such as for Lyme disease, and some basic physical exam. If all of that comes back normal, which it very often does, then some doctors are very dismissive towards the patients. Often patients are told that their fatigue is quote-unquote normal, or they are just getting older, it's just some stress, or that nothing is really wrong. This is very frustrating to people who don't feel right. They know something is wrong, but the doctor is telling them otherwise. But there is another common outcome that patients get when they complain of fatigue, and that is the suggestion that fatigue is a symptom of a mental illness or chemical imbalance. It has become medically accepted as fact that mental illness is a possible cause of fatigue, and that must be ruled out before a diagnosis of chronic fatigue syndrome can be made. The National Institute of Health's website says depression is a serious medical illness that involves the brain, and then it warns if you are one of the more than 20 million people in the United States who have depression, the feelings do not go away. They persist and interfere with your everyday life. And what are the symptoms? Well, those are sadness, loss of interest or pleasure in activities you used to enjoy, feelings of worthlessness, and thoughts of suicide. While those are symptoms that you would expect to be associated with mental illness, the National Institute of Health lists other symptoms that you may not usually think of as being part of a mental illness. These are changes in weight, difficulty sleeping or oversleeping, and energy loss. Energy loss and chronic fatigue are essentially the same thing. Chronic fatigue, changes in weight, and difficulty sleeping understanding, while they may occasionally be indicative of mental illness, in and of themselves they really should not be considered mental illness. For the most part, these are signs of poor health and can often be helped through natural means. To call these real medical problems mental illness is a very confused way of looking at health, and unfortunately a lot of times these are what's being used to get people towards the road of taking psychiatric medications. One of the reasons why the official numbers say over 20 million people have depression, yet comparatively only 1 million people have chronic fatigue syndrome, is that there is an overlap in the diagnostic criteria. However, chronic fatigue syndrome has a rather stringent diagnostic criteria which excludes many people with genuine fatigue, whereas the criteria for depression is less stringent and goes by a subjective checklist of symptoms which may or may not be part of a real mental illness. The diagnosis of chronic fatigue syndrome is also a lengthy process where all other possible causes of fatigue must be excluded. However, the diagnosis of depression or prescription of antidepressant medications is often quickly done and requires a lot less work. So what happens in practical terms is when patients complain to the doctors about fatigue, instead of getting a thorough investigation into the cause of the fatigue, patients are often referred to a psychiatrist or just told to take psychiatric medications for depression. The dismissal of patients who have fatigue caused by very real and fixable problems as nut jobs who need to be put on dangerous psychiatric drugs, which in the long run just makes them even more sick, this amounts to the total failure of the conventional medical system in understanding and treating chronic fatigue. Ironically, even if these people were given a more correct diagnosis of chronic fatigue syndrome instead of depression, it really wouldn't make a big difference since the treatment is basically going to be the same either way. For example, on the Mayo Clinic's website, possible treatments for chronic fatigue syndrome include psychiatric drugs for depression, pain medications, and sleeping pills. Really, has it ever occurred to these doctors that all these people are not tired because they have a clinical depression, but really may just be in a depressed mood because they are tired all the time and they don't have the energy to live their lives as fully as they like? However, depression and chronic fatigue syndrome are not the only diagnoses someone with chronic fatigue may get. The diagnosis often depends on what kind of doctor a patient sees and not what medical problem the patient has. A chronic fatigue syndrome doctor will diagnose a patient with chronic fatigue syndrome, whereas a depression doctor may diagnose the same patient with depression, and a fibromyalgia doctor will diagnose the exact same patient with fibromyalgia. By the way, fibromyalgia is a way misunderstood and overused diagnosis. There is an article on my website about what fibromyalgia is and what it is not for more information. And it is worth noting that if a patient gets the fibromyalgia diagnosis instead, we can see that the official treatment from the Mayo Clinic includes analgesics or painkillers, antidepressants, and anti-seizure drugs. Sleep medications are not listed, but they do list among additional treatments that patients make sure to get enough sleep, so you can only guess where that is going to lead. Therefore, 3 of the most common diagnoses chronically fatigued people get, chronic fatigue syndrome, fibromyalgia, and depression, they all lead to the prescription of antidepressants, as if these conditions were caused by some kind of antidepressant drug deficiency. Treatment plans for all these conditions also often include painkillers and possibly sleep medications. Some other common diagnoses the same patient may get from a different doctor is hypothyroidism, Lyme disease, viral infections, or to just simply be told nothing is wrong with them and it's just stress from normal aging. There definitely are some chronically fatigued people who truly do have hypothyroidism, fibromyalgia, Lyme disease, or some other illness and are being misdiagnosed by one doctor after another. However, we must be wary of any time someone attempts to lump up all people who have fatigue into the same category and suggest that they all be treated the same way. The causes of fatigue are just way too varied to do that. People must be especially wary when they told they have mysterious things called chronic fatigue syndrome, fibromyalgia syndrome, depression, or a chemical imbalance causing mental illness. These diagnoses are not based upon objective lab tests, but in the case of chronic fatigue syndrome or depression by checklist of symptoms, or with fibromyalgia by a cursory, non-specific physical exam. These are illnesses that are supposedly have no known cause, yet patients are told require years of dangerous, costly medications which are not guaranteed to lead to cure. Actually, at best, these medications just relieve symptoms and will almost never affect a cure. So please watch part 2 of this video for an overview of the very real and fixable problems which so often do cause chronic fatigue and associated symptoms in so many people.